So good morning, everybody. Today we are here for one of the important device protocols which we follow for patients where the syncope is not the main presentation, and this syncope is a unique syncope we call as a neurocardiogenic syncope, and in that we are implanting for the patients who are called malignant neurocardiogenic syncope. So syncope is a rare. Please. Syncope is a condition in which patient develop postural loss, and at the same time he recovers or she recovers immediately. So drop of the blood pressure is one of the response, and it can be due to the tachyarrhythmia, it can be due to the bradyarrhythmia. And there are some reflexes we call it as protective reflexes, which when get activated, Vasovagal reflex, which is one of the important reflex, if it get activated immediately, there is a drop in the blood pressure and as well as the heart rate. So vasovagal is one of the response which happens, and in that situation, the best thing is to prevent it. But in some patient, even taking the adequate care, we are not able to prevent it. So in that scenario, the two type of treatment, one is called conservative treatment, in which we advise the patient that they should be standing for a particular time in the touching their back part on the uh, wall. We call as a head up tilt training. And if the patient is still getting the symptoms, then we are giving the pacemaker. So this pacemaker are having a unique protocol, and every company coming with their different uh, algorithm for detecting and as well as treating this type of syncope. So neurocardiogenic syncope or malignant vasovagal syncope, if it is happening to the patients, in that scenario, we are activating those algorithm. So today we are with us Priya, who is from Abbott company, and she will be giving her company protocol, or we can say algorithm, which is Hysteresis Advanced. Other companies having the different names. So over to Priya regarding the algorithm advanced hysteresis for neurocardiogenic syncope. Thank you. Sorry. 1 minute. So Priya is from Abbott company, and she is very academic, and she will be giving the 1 minute. Sorry. Yeah, 1 minute. So over to you. Yeah. You can sit. You can place it. So, yeah, this is
Yeah. Hi, team. Good morning. Myself Devi Priya from Abbott. So I'm going to take a topic about advanced hysteresis today. What is advanced hysteresis and where we can use this algorithm for which kind of patient it would be fitted? So we have two type of patient like vasovagal syncopation and neurocardiogenic syncopation. The both patient is like not a very symptomatic patient in an instant. In sometimes the patient when the heart rate might go down immediately, which we call as a rate drop, sudden rate drop. So with that rate drop, the patient's CO and the cardiac output and the patient might get into syncope for a minute or so. So it can be treated with the algorithm. It can be treated with the pacemaker, which is having an algorithm of rate drop response. In other company they will tell, and it is for in Abbott we call it as a advanced hysteresis. Where the patient's heart rate will be suddenly when it is dropping to below 50 or the 60, which is the lower rate which have been programmed, it will automatically increase the rate to above the basal rate, like plus 20 or 30, which is like recommended from the physician. So advanced hysteresis is a patient already it's for a neurocardiogenic syncopation. It allows the patients allows the device to respond to the response. Like when the heart rate goes below the 50, it will automatically pace at the higher the base rate, which is programmed. Like if it is a 60, then it will pace at the rate of 90 or 100. In Abbott, we have three programmable parameters, which is like intervention rate and intervention duration and recovery time. We'll see what is that. Like first is intervention rate. When the heart rate of the patient is going below 50, when it sees it rate drops below 50, then in this intervention rate automatically gets on, and it will pace at the rate above the basal rate, which is nominally 90 or 100, which is like directed by the physician depending upon the each patients. So the next parameter is like intervention duration. For how much time at this rate it should get paced. It is like nominally, clinically, it is beneficial by increasing the cardiac output. So depending upon the patient cardiac output decrease everything. So nominally it will pace at the rate of like time of 3 minutes at the rate of intervention rate which has been programmed. So it is next is recovery time. This vasovagal syncope or neurocardiogenic syncope, it will happen just for a 1 or 2 beat. So after that, the patient will be having a native rhythm. So the device should not pace more than like what we have programmed. So the recovery time will be like after the patient is getting a pause or syncope, it will pace for 3 minutes, and later the recovery time, the patient's own native rate should come back. So normally the recovery time we will keep it as a medium. So it will gradually reduce the rate from the 90, 70, 60, and will pace at the rate of basal rate. It usually happens in the sinus. So nominally in programmer we can see when the rate goes from like it is going from ascens vescens, and suddenly there is a drop, then it will start pacing at the atrium only. It will not pace at the ventricle because the vasovagal syncope, it will start from the sinus. So this is the programming screen. Like when the hysteresis rate is getting initiated. Hysteresis is the rate which is lower than the basal rate. So with the ascens initiates that hysteresis rate has been initiated. So it starts with ascens vescens. This patient could be a patient with the vasovagal syncope with intermittent AV block. So the patient is having an rhythm of ascens V pace. So this patient, like you can see initially it is happening ascens V pace, and there is a sudden drop, and later the intervention pacing and intervention duration begins, where the rate will be more like around 90, and it will pace for 3 minutes to increase the patient cardiac output and QL, quality of life. So this is the algorithm behind it. For a patient, we are keeping the basal rate of 60 and hysteresis rate of 50. The cycle count is like if it sees one drop of the beat below hysteresis rate, then the intervention rate starts, which is like intrinsic rate plus 20, which is like basal rate of 60 plus 20 means it will be pacing around the rate of 80. And the intervention duration is like for 3 minutes. So you can see when like the heart rate goes like touches below the hysteresis rate, it is pacing at the rate of 3 minutes here, and the recovery time, there is a gradual reduction of the rate from the rate of 142 to the lower rate of 60. So advanced hysteresis, like if the patient, it can be programmed to all kind of patient. So what happens if the patient is getting rest or in the sleep? If the patient is getting a sudden rise in the heart rate, like around 90 or 100, the patient could feel palpitation. So we do have another programming value which is called rest rate. So during the rest rate, if the patient is having any drop in the rate, it will directly pace at the rate of the hysteresis rate. During sleeping or rest, the patient cardiac output will be a stabilized one. So if the heart rate is pacing at 50, the patient will be more sufficient, and patient will not feel any palpitation during the rest. So this is the algorithm behind it, and it is pacing like ascens vescens is the patient's native rhythm, and we could see a patient's heart rate got dropped of 1 beat, and the next beat happens at the rest rate or the rate of same rate. We could see the same rhythm before and after. So there is no sudden increase of rate rise in like around 30 beat or 40 beats. So patient will not feel any palpitation during sleep. So previously we saw the patient at the rest. What if the patient is running or doing any extensive activity, physical activity? If the heart rate is the 100 heart rate which we program the intervention, it is not sufficient. And during exercising, the patient cardiac output, they might require more cardiac output for their exercise or any physical activity. So this algorithm we have is like maximum sensor rate. When the patient is doing any physical activity, then the intervention rate automatically paces at the rate of maximum sensor rate, which is 150, and which is also programmable depending upon the patient's age and everything, depending upon the physician who is diagnosing the patient. So we can nominally it is around 130, and we can program to the younger patient like more than 150, or any like a less physical activity patient we can program 120 also. So the clinical benefit of this algorithm is like to reduce the patient's syncopal or near syncopal activities, and like any complaints, the patient will come up to the hospital. Being having a pacemaker, the patient may could feel syncope. During that time, we can analyze and we can program this advanced hysteresis, so the patient will not feel any any syncopal activities post pacemaker. So this will increase the patient to feel better and comfortable, and their quality of life would be improved. And like in Abbott, we have like this algorithm could work along with the rate response mode also. In other companies with the DDD only, without rate response only it will work. But in Abbott, if we can program along with the DDDR, we can program this advanced hysteresis. There is no there is no opposite calculation or anything. It will work along with the rate response also. So thanks for the opportunity, and this is the simple algorithm.
There are a few questions we want to know.
Yes.
This one is that you told that by night time the heart rate will automatically
Goes
go
down.
down.
Yeah.
How the device is detecting when it has to go into the normal hysteresis, what you call.
So we have a clock time.
Versus the patient who are having the vasovagal type of effect, it is detecting and it is started releasing.
Okay, so like in normal condition, if the patient is doing a minimal activity, then we for the patient who's having a rest rate, the rest rate will not work along with the clock rate, sir. It works along with the respiration rate of the patient. The normal rest rate we have in Abbott, that doesn't work with the clock rate. In other company, it works with the clock rate, the timing which they program from 9 a.m. to 5 p.m. So that thing. But here it works with the respiratory rate. The sensor itself is different. So the calculation depending upon the respiratory rate, it automatically finds that the patient's respiratory rate is low. So it will automatically detect the patient is on rest, not doing any excessive activity.
So algorithm detects one is the respiratory rate,
which is a rest rate,
and at the same time it is going to see the rate drop.
Rate drop.
So rate drop, what your company versus other are different. One is the 3 weeks has gone all of a sudden means
like we can.
It has gone to 40.
Yeah.
So how your device is detecting versus the other?
So other company devices, like they doesn't have that programmable value. Like they have deduction window and deduction rate and that thing. Like where we can program the cycle count also, how much heart rate is getting fall, and what is the like duration to pace also.
So how many cycles?
Nominally one will program one cycle. Only one beat if it deducts the drop rate I am talking, sir. When it sees only one drop rate which is equal to hysteresis or less than hysteresis rate, it will directly pace from the next beat, the intervention rate starts, sir.
What happens if the patient is having VPCs? VPC and after that the pauses come, the heart rate has been detected as around 40.
That will be in the alert period, sir. In VPCs also will be denoted as VS only. So the program, like the device thinks it is also an intrinsic activity, and it resets a cycle. That cycle will be in alert period. So in alert period, if it doesn't find any reasons, then this algorithm activates.
So it is the sudden rate, not the cycle.
Not the cycles, and it is a sudden response when the patient's heart rate is around 90 or 70. If it suddenly drops, we have a rest sensor, sir. The rest
so it is
sensor.
totally by the sensor, not by the rate.
Not it's by the rate also.
The patient is having rate of 90. The next beat has come all of a sudden due
to
to energy.
Yes.
It has gone to 50.
Yes.
For 2 weeks, and then after that it is normal.
Yeah, it deducts depending upon the rate also, sir. And for rest rate, for rest rate, if you are programming, that it will calculate with the rest rate and the rate also, normal rate, basal rate also.
Okay. So what we have normally we program around 60, heart rate of 60, or we can say 1,000 cycles that we have kept it. And the person's heart rate has come to 50, so it will get activated?
Yes, sir. If the patient is not being programmed with the hysteresis, means it would automatically get activated. If, for nominally for vasovagal symptom or neurocardiac symptom, we will program the hysteresis rate because we
Around how much you will
10 beat minus from the base rate, from minus 10 we will program, around 50 we will program it.
Thank you so much.
Yeah, thank you so much.
So
Right.
I will check. Yeah. Just one or two points I just want to share. So a rate response. One is vasovagal when it is happening. What is the compensatory mechanism? So one compensatory mechanism to increase the rate. So if the pacemaker is there, you can still prevent it. If the device is having a protocol in which we can activate that the heart rate vasovagal response, normal response will be the base rate will be coming. But here what we are doing, what Priya was saying, that we are pacing at a higher rate. And this higher rate has been resting rate is maybe 60, we can keep 20, 30 depending upon the patient's cardiac function. So if the cardiac function is low, the drop will not be so much compensated because the contractility is less. So the response we have to compensate by the rate. So keep the rate more, means around in place of 10 we can keep 20. But when the patient is having a good cardiac function, we don't want the heart rate should go down. If the vasovagal has happened, there is a drop in the blood pressure, and at the same time there is a drop in the heart rate. These are the syncope in which this pacemaker will work. So the what you call the neurocardiogenic syncope, where the blood pressure as well as the pulse, in which the pulse, if falls first, it will be responsive. If pulse means we can say heart rate is coming later on, we call as a more a dominating hypotensive response, that's a vagal response, then it will be different. So when heart rate is coming down first, later on blood pressure is dropping, this algorithm will be activated, and that's why we have to ask from the patients. Number one, what type of vasovagal has happened? So there are three responses. One is a mixed, second is the hypotensive, third is the vagotonic, means the heart rate has come down. So if it is a predominantly vagotonic, this is the pacemaker where it is going to work, because the heart rate is dropping after the blood pressure is falling. Blood pressure will certainly fall after some time. But if the blood pressure is only falling, heart rate is not falling, then it is not going to work out. So this protocol we have to accept, give the opportunity to those patients where the vagal is the heart rate is the lower, coming lower all of a sudden. And I think from the company to company, they have different protocols. In this, we should know that hysteresis has to be activated, and that's why I always ask from all the persons who are implanting or who have implanted, always ask from the doctor what he exactly wants. If it is a vasovagal, we have to give two prescriptions. Number one prescription is the lifestyle modification. He should go for the head up tilt training, and training is nothing. He has to stand every day. There is a reflex which will be activated at a particular time frame. So when he is standing in front of the wall, he will be having a reflex that he can hold himself. And we usually do while in the head up tilt test, we will keep the patient in that posture. Exactly at particular time, the blood pressure and heart rate will start falling. So we are knowing that this person is having vasovagal activated at 15 minutes. So every day we are going to train him in the same standing posture against the wall and increasing the time. And slowly, when the blood pressure response is coming, we are again making it horizontal. So this is the first. And second, if still the patient is not tolerating on and off after training, then this reflex can be countered by putting the device dual chamber pacemaker. It should be dual chamber pacemaker. And on top, there should be the reflex that advanced hysteresis in, I think, in Abbott, and RDR is in the Medtronics. RDR, red drop response. I am not aware what is the protocol for the Boston and Biotronics. So everybody must be having there, but if these two companies, I know that they are having a very good, robust vasovagal reflexes protocols to be activated if the patient is having neurocardiogenic stroke syncope. So thank you so much. Next time again we will meet with some important device related algorithm. So see you next time. Thank you. Thank you.